Thank you very much for inviting me to speak here. It's a real privilege to see so many people interested in rare diseases. So I realise that I have the bell behind me, so I'm going to move on pretty swiftly rather than give a general oration about rare diseases. But I'm actually one of those clinicians that's made that misdiagnosis, so just be kind to us if that happens, because part of the time we don't like to be wrong, but we're a bit scared if you know more than we do, and that can be difficult at 3 in the morning if you turn up. So just realise that we're human, and we want to help, but sometimes we don't know as much as you, and if you can help us along with that, that's most appreciated. So this is me. I've been to lots of different places, and I've ended up in Cambridge. I came here 6 months ago. So I did my medical training in Glasgow. I lived there all my life, and that's Hogwarts or Glasgow University in the corner. And I did my thesis there as well, which was in rheumatoid arthritis. So that's a common disease, but it's probably being made a bit rarer now when we look at subtypes. I spent some time at NASA looking at aerospace medicine, and also did some training in Oxford. I've been to Malawi for projects, and INSEAD for commercial things, and also some public engagement. But speak to me about these things later, because I'm going to speak about inflammatory bone diseases. You might not know too much about them actually, but a few patients who come through to our clinics have these. And it's a bit of a difficulty because they come in with pain, stiffness and swelling like everybody else, but they also have other problems such as issues with their skin, and it can affect children or it can affect adults. And one of the conditions is called SAPHO, the other one's called CRMO or CNO, and the problem with rare diseases is they sometimes change their name, because as different people have been working on them, it turns out to actually be the same disease. In general, what happens here is there's involvement of the skin with pustules or neutrophils or pus-forming cells going into various areas where they shouldn't be. And that causes quite a lot of problems. Prevalence, who knows, anything from 1 in 10,000, could be a bit less, could be a bit more, and I'm sure those of you who work in rare diseases have heard these figures before, that people aren't actually too sure how many people have got the disease. We don't even know if it's more common in males and females, hence why there's so many question marks. And it can affect other organs. People can get bowel disease, they can have Crohn's disease or ulcerative colitis, they can have inflammation of their blood vessels. And these are the kinds of things that it can cause. It can, for some reason, it increases the size of the clavicle, your collarbone, when it hits the breastbone. It causes inflammation there. You can have pustular disease of the skin. That's actually an MRI of the breastbone. Black is okay, white is bad, that's inflammation. And this is a bone scan, and this scan should look much like this kind of grey colour. And in all these areas where things are black, that's where the tracer is going, and these are actually inflamed bones. This person here's got a big load of inflammation just on their knee. The problem is, loads of people say, well actually the prognosis is pretty good. I think if my knee was that inflamed, I wouldn't say the same. So what are we going to do here? We've got patients, which is good, but we have them in a clinic, the Metabolic Bone Clinic, and two very friendly clinicians who work between the University of Glasgow, University of Cambridge and also the hospital. We've got the bioresource, an NIHR bioresource, something, the NHS arm that does research. And there's very helpful people who are going to be helping us to collect samples there and also help to engage with patients. We're going to collect lots of samples from people, but we're going to collect clinical data because samples without information are generally meaningless. And there's a few people that I've worked with before, and also some colleagues who I'm going to be working with in the future who are going to help with that. And finally, once you have this information, you need to know what to do with it. You need people who are going to fight alongside you and not tell you that you need to collect 10,000 samples, and when your condition you can only collect 700 to 800, and who will actually give you an idea that this is what you can do with this. And finally, we need to keep on going round and round. We need to refine what we're doing and continue to engage with people. And then the main thing that we want to do is this is locally, we then want to roll out nationally. And with the NIHR, this is something that you can do. You can get your study adopted so that, as well as looking locally, they help you up and down the country to recruit patients. And then hopefully, I prefer this map actually, it's got Scotland on it as well, the other one doesn't. Because I know people who do that kind of research up there as well. Sometimes people say genetics is very important, but giving genetics a hand is also important. And sometimes using things like proteomics with companies like Olink can help give a handle or give you an idea of which genes to go after, and whether it's actually just a phenomenon that you're seeing or whether it's actually a cause that might be worth investigating and drugging in the future. I like this film. This is from Rogue One. And you know, there's a moment when you say, well, what hope have we got? Well, actually, revolutions are built on hope, or rebellions are built on hope. And I love what she says, because, you know, without somebody starting, but without other people joining in it, we're not going to get there. And we want to do interesting things in the future. We want to go through social media recruitment, also imaging databases and international collaboration. So hopefully by doing this we can increase knowledge, increase research, but also build capacity for trials of new or old medications and repurposing. Thank you very much.